We're going to have ongoing coverage of that story throughout the day. But let's go to Tim Houston, the Premier of Nova Scotia. We're getting an update on COVID-19 in the province. This is coming to us live from Halifax. Let's listen in.
There are many rumors, but the reality is that if there were any hospitalizations, we would know, and we're not aware of any. So this is good news. But also we have to be mindful that so far the majority of cases have also been in younger people. So in summary, the variant spreads faster, but it appears to be less severe. We also know that the vaccines are an extremely important layer of protection. But despite that and our encouraging vaccination rates, we need to slow the spread of the variant down. There have been many questions about fines and enforcement, and I think my personal feelings on this are well known. But what we can say today is that the investigation continues. And as that investigation will continue, but today the focus is on keeping people safe, and that has to be our focus today on dealing with what's in front of us right now. So our immediate goal is to slow the spread, and Dr. Strang reminds all of us that we've been here before. And what worked in the past will work again. That means people using common sense, but it also requires some government guidance. So that means bringing back some of the restrictions that were in place for phase 4, which helped to blunt the third wave in particular. And Dr. Strang will give you the details. But starting Friday, gathering limits, physical distancing, tightening up on the masking, all these things will be back in effect. We're also getting a lot of questions about schools. For some, there will be a public health reason to close a school, but when that's the case, it will be communicated to those communities. For the rest, there's no public health reason to close your school, and your school will remain open. So I understand, we know that there may be some operational challenges with schools, but we'll continue to monitor throughout the week, and if there are any changes, we'll update. But other than that, school continues as planned. We have high vaccination rates, and that's a good thing. The variant does not trigger as severe of illness in most cases as some earlier strains, and that is also a good thing. But still, it would not be appropriate to do nothing in the face of such rapid spread. So we're taking action, and Dr. Strang and the Minister will speak to that. But just remember that together we will get things back under control. I have no doubt about that. So I'd like to ask the Minister to step up now.
Thank you, Premier. I wish I could be there with you in person. I'm here in Antigonish. It's important to me to be here while we deal with this outbreak locally. There is much anxiety here right now, and even some anger, and those are normal emotions in a situation like this. But we can't let our emotions consume us. Instead, let's change those emotions into actions. Get tested, wear your mask, and watch for symptoms. If you haven't been vaccinated, book an appointment now. If you're eligible for a booster, book it now. For parents, children 5 and up are now eligible for vaccines. Again, please book your appointments. While Omicron is very contagious, if we work together and follow public health's guidance, we will reduce the spread and contain the virus. It will mean some sacrifices, like not being able to do all the things we want and not having big get-togethers over Christmas and New Year's. But that's how we will protect our neighbors, our community, and the province that we love. A key action is testing. Anyone who has symptoms, is a close contact of someone who's confirmed case, or was at an exposure site at the time listed in the exposure notices should book an appointment online. That goes for the St. Yves community, the broader community, and anyone who is visiting. I've seen the lineups at the local testing centers, and I want to say thank you to all of those who've gone to get tested. The Antigonish testing clinic on Church Street has lots of appointments for PCR testing. Public Health's mobile testing unit has been at the Keating Center doing PCR testing and handing out take-home rapid tests. The university also has a substantial supply of take-home rapid tests that it's distributing to students. Students who are isolating because they tested positive, have symptoms, are close contacts, or were at exposure sites need to follow public health direction. You can't stop isolating until you've got your negative test result or you've been told by public health that you're free to go home. We understand that this may impact your travel plans, but it's important to follow these rules to prevent spread. For any students who haven't been directly impacted by the outbreak, public health has asked that you take a rapid test and have a negative test result before leaving for the holidays. Again, this may alter your travel plans, but it's important to help prevent the spread. For the broader community, the library on Main Street will have rapid test kits beginning tomorrow. These are intended to help with safer gatherings over the holiday season, and I encourage local residents to pick a kit up for your family. There are limited supplies though, so students should continue getting their rapid tests on campus. For Nova Scotians, rapid testing kits will be available in libraries, family resource centres, and at the mobile outreach immunization clinics throughout the province. Nova Scotians should expect that the availability of rapid tests will be within 20 to 40 minutes of your home. Testing is important to identify the virus and discover where it is early. Finding that out is critical for such contagious variants. We need to continue to protect our healthcare system. Protecting our health system means our doctors, nurses, and others can treat the ill, those with COVID and those without. A health system overwhelmed by COVID has to make choices. We are still trying to catch up on surgeries and procedures postponed by the last wave earlier this year. Our healthcare workers are tired. They've been focused on the pandemic for 2 years. They are our friends, our family, and our neighbors. The health system is all of our responsibility. So let's protect it and our loved ones and do what we can to stop the spread now. Dr. Strang will now tell you a few more details. Thank you.
Thank you, Premier and Minister, and good afternoon, everybody. Today we are reporting 114 new COVID-19 cases. We've had 3-digit case numbers for several days, with the majority in eastern and central zones, and many are tied to the outbreak associated with St. Francis Xavier University. Nova Scotians should expect to continue to see high daily case numbers, and cases will go up before they go down. We are also, unfortunately, announcing an outbreak at a combined long-term care home and a retirement living facility in Antigonish. One staff member has tested positive at the long-term care home, Mary's Court, and 2 staff members and 2 residents have tested positive at the attached retirement facility, Parkland, Antigonish. Public Health is working closely with the operator and staff to manage these cases. Unsurprisingly, we are also now confirming that 40 of the samples that we've submitted to the National Microbiology Lab have been confirmed to be the Omicron variant. And we can assume that a growing percentage of our cases will become this variant. What we do now in response to the new variant is no different, however, than what we've done in previous waves and with other variants as they've occurred. And I've been asked, why do anything? What's the panic if we're seeing mild illness and we're all vaccinated? My answer is this: there is no need to panic, but there is a need to be cautious. We don't know enough about this variant to wait and see what happens. We cannot take the risk of wider spread into more vulnerable groups like seniors and those who are immune compromised, and potentially putting a pressure on our healthcare system. So we're focused. So we're going to focus on tightening up in 3 key areas to try to get things under control: masking, gathering limits, and physical distancing. I do see these restrictions as an interim step while we learn more about the variant and get more people vaccinated. Restrictions will come into effect this Friday at 9 a.m. We will monitor how this goes over the holidays and reevaluate in early January. Our goal is to have the fewest amount of restrictions for the shortest period of time. I know the timing couldn't be worse with the holidays around the corner. We just seem to be getting some sense of normalcy back into our lives, and now there's a new variant and things are changing yet again. This pandemic is not kind. I understand that people and businesses will be disappointed, frustrated, and fed up. We are too, and we wouldn't do this if we didn't believe it was necessary, but it is. So starting Friday, we're bringing back the physical distance requirement. This means places like restaurants and bars, fitness and recreation facilities, stores and malls, museums and libraries can operate at their maximum capacity possible while ensuring that physical distancing is maintained. And we've done this before. How we are lowering the informal gathering limit from 25 to 20 people, indoors and outdoors. And we're also asking Nova Scotians to go back to socializing with a consistent social group. Pick your 20 closest friends and family and keep that group consistent. As the Premier noted, for right now, 20 is plenty. And to line that up with that, bars and restaurants will have a limit of no more than 20 people per table. And again, it needs to be that consistent group of 20, and the bars and restaurants there will have to be the required physical distancing between the tables and between groups. We're also bringing back the formal gathering limit for events and gatherings hosted by recognized businesses or organizations, including faith organizations. So the limit will be 50% of maximum indoor capacity to a maximum number of 150 indoors or 250 outdoors. And this applies to things like regular faith services, special events, meetings and training, and audiences for sports events and arts and culture events. For people like players, coaches, and referees who are participating in sports practices, games, and regular league play within their home region, there's a limit of 60, whether it's indoors or outdoors. The same goes for people like actors, musicians, and directors who are participating in arts and culture rehearsals and performances. Tournaments and competitions, whether in or out of the province, will not be allowed at this time. And just a reminder that children age 11 and younger have not been allowed to leave Nova Scotia or enter Nova Scotia to participate in sports and arts and culture events for the last few weeks. And it's also important to note that proof of full vaccination will continue to be required for all discretionary activities, even if gathering limits and physical distancing now apply. We are also tightening mask requirements. Masks are once again required in areas of, will once again be required in areas of workplaces where physical distancing cannot be achieved. And they will continue to be required in common areas and areas where people serve the public, and also if there's a workplace with poor ventilation. Starting Friday, the public must be seated to remove their mask for eating or drinking. All other mask requirements in indoor places remain, including wearing them when seated for other activities in indoor places. So this means that if you're at a late night bar or a nightclub, you must be, and you're not in your seat, you must be masked. And we'll be working with our sport facilities. So I'll use the Scotiabank. They will have to create a seated area up in the concourse by the concession stand, and that is the only place where people will be able to take their mask off to eat and drink. They will not be able to be in seats watching the event and also eating and drinking. As the Premier mentioned, we're doing some cleanup in the public health order to make sure it's clear that it's not just the individual's responsibility to wear their mask, but also that businesses and organizations will clearly be identified as having the responsibility for ensuring masks are worn as well. Enhanced restrictions are also being introduced in our schools. As of tomorrow, all schools will move to enhanced public health measures to reduce mixing and movement. And so those are the measures we have been using for the last few months when a school has some isolated identified COVID cases. Those will now be applied in all schools. And this means that things like after school sports, assemblies, and non-essential visitors will now become more restricted. And certainly more information will be shared with families later today by the Department of Education. We know that in shifting to long-term care facilities, we know that visits with residents in such facilities are extremely important, especially around the holidays. They will still be allowed to happen, but we need to put extra layers of safety. We already have a full vaccination requirement in place for visitors, except for end-of-life visits, and masks are already required. Now that physical distancing is in place again, visitors will be limited to having a quick, close contact like a hug, but then the remainder of their visit will need to be distanced, and masks need to be worn throughout. We'll also be limiting the number of visitors at any one time to a resident. Residents will only be able to leave their facility for overnight visits if they are fully vaccinated, and we also strongly recommend that they don't leave for these visits unless they've had their third booster dose as well. And as I said, we're also limiting visits to 2 people at a time, and are strongly recommending that the visitors do a rapid test within 24 hours before visiting. And as of today, I'm pleased to announce that rapid test kits are available at libraries throughout the province. The supply is not unlimited, so please just take what you need and don't stockpile. But that's another point of access for rapid test kits for the public. I want to talk now about how we're reporting and investigating cases by public health. We are reporting lab-confirmed cases at this time because there are simply too many cases to be investigated and entered into a timely manner into our public health information system panorama. The spread of this virus and the volume of cases has exceeded public health capacity. And given high case numbers could continue for a while, we are focusing our efforts on cases that involve vulnerable people and settings like schools, long-term care facilities, and healthcare facilities. Public health is still making an initial call within 24 hours of a confirmed positive test result, but in most cases, this may be the only contact with public health. During those initial calls, the majority of people will now be directed to, self-management advice, and there's a lot. We have rapidly developed a lot of online materials that people can use to follow what's required for them in terms of testing and isolation, and also how they then go about contacting their own close
All right,
contacts.
so we're listening into new restrictions in Nova Scotia, a depressing reality in light of Omicron. On Friday, limits on gatherings, distancing to return, new and tougher masking rules as well. Sign of the times these days. We're going to keep our eye on what's happening in Halifax. Let's